Dr. Neha Narula with Stanford Healthcare joining us now to talk about the latest on the vaccines and the variants. Thanks for joining us.
Thank you for having me.
The CDC now talking about this Delta variant that is causing concern really around the world as a variant of concern. What does that mean?
Yes, so over the last 15 months, we've certainly seen some worrisome variants after the initial wild type infection that spread across the world last year. The Alpha variant, or the B117 from UK, then we saw Beta variant from South Africa, the Gamma variant from Brazil, and then now the most recent Delta variant, or B16172, initially identified in India, has now been characterized by the CDC as a variant of concern. It's actually spread rather rapidly from South Asia into 74 other countries, including the UK, where it is now the dominant strain and has officially set their reopening plans back by a few weeks. Here in the US, it is now accounting for about 10% of all COVID infections, and in some Western states, it's actually thought to be higher. And it doesn't sound like a lot, but the trend we're seeing is that the number of infections caused by this variant is doubling every few weeks. And it's thought that by fall, this will become the dominant strain here in the US. The good news, however, is that it looks like the vaccines offer some excellent protection against this particular variant as well. Just this past week, we saw some promising data come out from the UK suggesting that not only are the mRNA vaccines, or Pfizer and Moderna, effective against this. We're seeing at about 88% effectiveness against symptomatic disease, but also the viral vector vaccines, the J&J and AstraZeneca, also seem to be about 60% effective against symptomatic disease caused by this particular variant. So good news is that we have the tools to defeat this virus, in particular this variant. However, it's important that we continue to use these tools. We are seeing some plateauing of the actual vaccine rates, and so we want to continue to urge teens, our unvaccinated adults, to go out and get this vaccine to prevent another uptick, another surge in our country. Let's learn from our global community and actually continue to vaccinate so we can prevent further increases in infection and death rates.
No, from the figures that you just mentioned, it looks like it is still possible to get a symptomatic case, even though you have been vaccinated, particularly with the J&J vaccine?
Yes. Unfortunately, the vaccine, this particular strain is quite strong. What we're seeing is, and this was confirmed in the data coming out of the UK, that this particular variant is transmissible. Now, when we saw the initial Alpha variant from the UK, we saw that it was about 40% more transmissible compared to the wild type variant. Now, comparing Delta to Alpha, we're already seeing that it is about 60% more transmissible in comparison. Additionally, what we saw this past week, the data that came out, also is showing that this particular variant is making people more ill. So certainly as this virus is spreading, we're seeing it evolve and mutate into a virus that is stronger, more transmissible, and causing more severe disease.
Now, a new study looking at the efficacy of a different kind of COVID vaccine. What can you tell us about those results?
Yes, that's right. We have some excellent data coming from the phase 3 clinical trials showing efficacy of the Novavax, which was recently published, the PREVENT-19 study. And it actually compared 2 shots of the Novavax to placebo in about 29,000 individuals here in the US and Mexico. 2/3 of these individuals were vaccinated with Novavax, and then 1/3 was the placebo group. And what they found was that overall efficacy rates were as high as 90% and about 93% effective in the additional variants that we're seeing. They haven't yet tested against the Delta variant, but the Alpha, Beta, and Gamma, we believe, will be covered by this vaccine as well. In the entire study, so 30,000 people, only 77 developed an infection, and majority were in the placebo group. So very, very exciting data that came out. It's another contender in this market, and And so I'm super excited that we'll have more of a global supply. We can get more individuals vaccinated on an international level, and stop the rate of mutations and hopefully put this pandemic behind us.
Yeah, certainly. And it looks like at this point, most people across the U.S. have an opportunity to get vaccinated. They're available, readily as a walk-in in many drugstores. But what is your message to people who are still holding out at this point and they say, I haven't gotten it yet. Why do I have to worry about it now?
Yes, so certainly there's a lot of skepticism still out there. In today's age of information overload, it's at our fingertips through social media, through blog posts, through online communities. I just want to encourage our viewers, my patients, our community here in the US, in California, to go to a reliable resource. I, like many of my colleagues, would be happy to talk to you through questions that you may have, through some of the information you may have read. What I personally have seen in my patient population, in my and myths in social media, as well as conspiracy theories and just plain and simple false facts. And so it's really, really important to get accurate and reliable information. And so, we're here to help. I'd love to clarify a few myths that I personally have heard. One of them,
Please.
Like you had mentioned, I haven't gotten the infection yet. I don't need to get the actual vaccine. I'm okay. So as we're seeing, unfortunately, as this virus continues to evolve and mutate, it is doing so in people that have not been vaccinated. It will continue to evolve if it continues to spread and infect individuals. And where we're seeing these pockets of outbreaks come up are in unvaccinated individuals. And this virus is getting stronger and causing more severe illnesses. And so, while so excited that you personally may have not been infected, that doesn't mean you won't be in the future. And you want to prepare your body, protect your family members, protect yourself the best you can against a severe infection. Another common myth that I've been hearing is that, this vaccine was rushed. We don't know if it's safe yet. I think we can all agree, yes, these vaccines were developed in record time, but this technology is not new. We've had the mRNA technology for many, many years. The reason why vaccine manufacturers were able to develop these vaccines so quickly is because this technology has been studied for years. And the fact that globally our international community came together, allocated resources and finances, and it came together to create these vaccines in record time. And that's just been a scientific achievement. These trials were conducted in compliance with all of the rules and standards and protocols, and no corners were cut. Now we have 5 vaccines now that have studied their results in thousands of people. And additionally, we now have millions of Americans vaccinated, and the numbers prove themselves. We are seeing lower numbers of infection, lower death rates in the vaccinated individuals. And so, that they show how effective they are, and safety-wise, no corners have been cut when these vaccines were studied.
And actually, there's another one I wanted to touch on, and it was that people who are vaccinated are the cause of the mutants, that some of these variants are arising because of the vaccine. Squelch that one for me, if you will.
Absolutely. So, the vaccines do not have any active virus in them. You cannot get the infection from getting the vaccine. That's not scientifically possible. There is no physiological way you can get an infection from the vaccine because you are not getting the entire virus given to you in that vaccine. And so the only way a virus can enter your body is through an infection, not the vaccine. And once you are infected, that's really the opportunity the virus has to propagate itself, evolve, and continue to mutate. And so no, you cannot actually get the infection from the vaccines, any of the vaccines on the market at this time. That is a completely false claim.
Okay. Dr. Neha Narula, clearing up some of the misconceptions. Very good perspective. Thanks for that. We appreciate it.
Thank you for having me.